Welcome, everyone. My name is David Armstrong. I'm a director of the Health Workforce Tactical Assistance Center, and welcome to today's event. Today's event webinar is entitled Introducing the AWARD Network Data Compendium, a new resource for direct care workforce research. But for those of you who are not aware, HWTAC is based at the Center for Health Workforce Studies, located at the College of Integrated Health Sciences at the University of Albany State University of New York. And we're one of like 9 health workforce research centers, federally funded health workforce research centers located around the country. And today we're going to be joined by some colleagues from another one of the centers, like in California, San Francisco. And our mission is to provide technical assistance to states and organizations that engage in health workforce planning. And to do so, each year we conduct a number of health workforce initiatives. And so for those of you who have not already, by all means, check us out on our website at healthworkforceta.org. We have an extensive resource library of videos, webinars, reports, resource briefs, etc. And by all means, sign up to our mailing list so you can be notified of upcoming webinars and also just research alerts in general. Now, with that said, let's get on to the show. Today, we're joined by Lei Chen and Jenny Kwon, who are both postdoctoral scholars at the University of California, San Francisco, Philip R. Lee Institute for Health Policy Studies. Welcome, Lei and Jenny.
Thank you so much for the introduction, David. Hi, everyone, and I'm Lei, and today I will first provide an overview of our data compendium, and Jenny will introduce an example of using the data compendium. So let me share the screen. Okay, so for those of you who may not know what is AWARD Network, we are an NIA-funded project aims to advance research on healthcare workforce that serves people with dementia. And our main activities include monthly webinars, annual meetings, summer training institute, which we just finished our second summer training institute last week in San Francisco. And also we have pilot funding, and this data compendium work is also one part of our main activities for the AWARD Network. So before I start, I want to thank Jenny and also our research analyst, Kyoko Peterson, for their contribution to this data compendium, and also thank our PI, Dr. Joanne Spatz, for her support throughout this developing process. So at beginning, I would like to give you a brief goal of why we want to and what is this data compendium about. So this data compendium will hope to develop a research-ready, harmonized data set of policies and programs that affect demand, supply, working conditions, and the skills of direct care workers. We hope to organize a ready-to-use data resource, especially for early-stage researchers who are new to this field, and help identify research gaps that can be filled in by leveraging this data. So all the information about our data compendium can be found from our AWARD Network website. And though our main goal is to focus on direct care workers caring for people with dementia, our data compendium broadly addresses the long-term care workforce. So I would like to give you a brief introduction about what is long-term care workforce. So the long-term care workforce includes many different occupations with varying levels of training, certifications, and responsibilities. The main settings include nursing homes, residential care settings such as assisted living, and home and community settings. So there are a couple of occupations like direct care workers include certified nursing assistants, personal care aides, home health care aides, and also nurses work in these settings. So as we may know, direct care workers provide 70 to 80% of all hands-on personal assistance in these long-term care settings, which is a very important workforce. And recently, the demand for direct care workers and nurses in long-term care settings is increasing due to the aging in the U.S. population and increasing prevalence of the dementia. However, there is a big shortage of both nurses and the direct care workers in long-term settings. Especially direct care workers face challenges such as like limited benefits, physically and emotionally demanding workloads, high workforce injury rates, and limited training and career advancement prospects. Moreover, there are lack of policies and research data about direct care workers. There is no standardized policies for direct care workers across the states and all across the settings, and there is insufficient and underfunded data collection system. So we try to fill in this gap a little bit by developing our data compendium. So how we develop this data compendium, we start from selecting some policy topics and related to the direct care workers in long-term care settings. These topics come from our funding application, our members' suggestions, and also our previous summer institute. So we start from these 7 initial topics, such as state Medicaid waiver programs, wage pass-through laws. Right now, we expanded to mandates related to wage benefits and pass-through laws, training regulations for direct care workers, which I will present an example about this topic, and some staffing regulations for nursing homes and assisted living facilities and other 3 topics. So for each of these policy topics, we develop 3 parts of the products. The first, we start describing what is this policy about and how this policy is applied in each state. And then we provide a list of data sets organized in tables to show some brief description and selected information of these data sets. And based on this information, we develop Excel sheet that can be directly downloaded. We call it harmonized data set. So all the variables are organized in the state levels and organized in Excel sheet that can be directly downloaded by researchers for your use. So we have all these topics ready for the first round of update by 2025. And after that, Jenny joined our team and we started updating all of the topics. So we are hoping to have the second round of updates ready by next year. So here is the example about how this data compendium look like. So we give you example of the training regulation for direct care workers. The first part of product is a PDF document. So we start by introducing what is the direct care workers, their classifications, and the general training regulations for direct care workers, and any dementia-specific training and considerations for this workforce. So after that, we provide 1 or 2 examples of case studies to show how this training regulation look like in specific state. And after that, we provide a brief summary about what we find about the research and the resources related to this topic. So for these training regulations for direct care workers topic, we find that the training requirements for this workforce are very limited and differ greatly from specific job classifications, job settings, and states. Requirements for dementia care specifically are even more limited. Researchers often collect data about direct care workers training by conducting surveys, interviews, and interventions or organizing state regulations. However, there is still a lack of some recent data, especially dementia-specific training data for the direct care workers. So the resources for this topic come from peer-reviewed journal articles, government and organization reports from PHI, National Governors Association, and Alzheimer's Association. We consult the experts in the field about the resources, and we often put the public resource there. But if the researchers agree to share their resource or data with us, we get their permission to share the data from themselves. So the next part is the list of the data sets. So in this part, we also consult with the experts in the field, and also some data come from peer-reviewed journal articles and existing reports. So we provide some description, time period, relevant variables, example articles, and other information for the data set. And so for this specific topic of training regulations, we use data sets from PHI, Assisted Living Stage Regulatory Review, National Council of Certified Dementia Practitioners, and recently we found Justice in Aging's Review of Dementia Training Standards. So not all of these data sets are in our harmonized data set because some of the data are in per individual level, or some of the data need access for us to get to their data set. And also some of the data sets they organized in the report like type, which is hard for us to organize to the Excel sheet. So, but for those, we can get by states, or we can easily convert those reports to the Excel sheet. We then develop our harmonized data set in the Excel format. So for this particular training regulation and requirements topic, we have 46 variables like in total included in Excel. So these variables are related to whether training is required in each state for a certain type of occupation, if there are minimum training hours for each type of direct care workers, and whether orientation required and in specific training requirements. And recently we added the dementia training required by states organized by the Justice in Aging, but the data is from 2015. So, and for each of the variable, we not only include the real data by states, we also include some other information like years of the data, their original name, characteristics, and some notes, especially the caveats of using the variable. So in general, all this data are directly are ready to use, can directly use by researchers, and they are organized by state. It means that it has the potential to be linked with other data sets which have like state variables. So some of the topics we have more variables, but some of the topics we have relatively fewer variables. And the time of the variables also varied depending on the resource. So here is a very recent, like the linked data set between our data compendium and National Dementia Workforce Survey, which is the largest and first workforce survey in the US about dementia caregiving. So we have this linked data set by using the NIA data linkage program. So if you right now go to the NDWS website, they have a web page about linked data resource, and our data compendium is already there. So you may apply for the access to this linked data set between NDWS and AWARD Network. So our UCSF team, we are working on a project about using this linked data set. We would like to examine whether nursing home and the assisted living staff report that they have had more training if they work in a state with direct dementia care training policies and other training requirements. We also want to examine whether workers in states with training policies report more confidence in their skills. And also, we want to know, examine the association between these training policies in the states and the worker outcome. So that is our in-process project. And Jenny will introduce another example, which is also use our variables from the data compendium and another data resource. So the innovation of this data compendium, the first is that it's organized based on the policies and the regulations related to the direct care workers in long-term care settings. And it's not a data compendium organized by only by specific data set or a single policy. So we are among the first to organize resource and data at the state level according to policies and regulations related to direct care workers caring for people with dementia. The second is our data compendium include diverse resources and the data sources for each policy topic. So we not only include the large like survey data sets or the data platforms that are often used by researchers in this area. We also include some government reports, organization data, and the reports that are not used very often by the researchers. And also, the other innovation is it has potential to link with other data resources as we are organized in the state level of the data. So here are some implications for policy and research. The first is the ready-to-use data resource for early-stage scholars. And we also help identify some research gaps that can be filled in by using the data set. And also there are diverse of research related to the policy work. And we hope to inform the development of the future data compendium, like for example, for other like type of workforce related policies. And it also has the potential to inform evidence-based policies and program development. So right now we are working on updating our data for each topic, and we are also working on organizing a list of control variables from the American Community Survey. We want to get the demographics of workers and in each state, and also we are working on organizing some data from the Bureau of Labor Statistics to get a profile of staffing situation settings, estimate of direct care workers, and other staffing characteristics, which we hope can be added as the control variables for researchers to use for your models more and others. So yeah, here is the publication we published last year in the JAMDA. If you want to get more information, please feel free to check this article or go to our website. We have all the information about data compendium there. So thank you very much. And right now I will turn it over to Jenny to provide an example of our using the data compendium. Thank you.
Thank you, Lei. Can you see my screen? Okay. So now that you've seen an overview of the AWARD Network Data Compendium, I would like to show you one example of how we can use this resource in research. In this study, we used variables from the data compendium to examine how state-level staffing regulations are associated with staffing patterns in residential care communities. Before I begin, I would like to acknowledge our funding and data use disclosures. This project was supported by the Health Resources and Services Administration, or HRSA, within the U.S. Department of Health and Human Services. The findings and conclusions presented today are those of the authors and do not necessarily represent the official views of HRSA, HHS, or the government. In addition, this research was conducted using restricted data through a Federal Statistical Research Data Center. All right, first, I would like to start with a brief background on residential care communities, or RCCs, in the US. RCCs, also commonly known as assisted living, provide long-term care for individuals who need help with daily activities in a residential care setting. In 2022, there were more than 32,000 RCCs nationwide, serving nearly 1 million residents. Among these residents, nearly 44% were living with Alzheimer's disease or related dementias, and about 75% required assistance with bathing. RCCs vary considerably in size, ranging from facilities with fewer than 10 beds to large facilities with more than 100 beds. Another important point about RCCs is that they have become an increasingly important part of the long-term care system. For example, employment in this sector has grown by approximately 93% since 2001, making it one of the fastest growing institution-based long-term care settings. And this is a huge increase considering nursing home employment decreased by 5% during the same time frame. Today, the workforce includes nearly 1 million employees, and continued growth is projected over the next decade. The total number of licensed beds increased from about 972,000 in 2010 to over 1.3 million in 2022. Despite this rapid growth, unlike nursing homes, RCCs are not subject to federal staffing standards. Instead, staffing regulations largely depends on the state level. And this creates substantial variation in staffing policies across states and provides an important opportunity to examine how these policies may influence actual staffing patterns. Given the variation in state regulations, we wanted to better understand whether differences in staffing policies are associated with staffing levels in RCCs. Specifically, this study examines three state-level policies. First, whether the facility has licensed staff requirements. Second, whether the facility has state minimum staffing ratio requirements. And third, whether the facility operated in a state with a minimum wage above the federal minimum level. Based on these policies, first, we expected that states with staffing ratio requirements would have higher staffing levels because these regulations establish minimum staffing thresholds. At the same time, we also expect that states with minimum wages above the federal level might have lower staffing levels due to higher labor costs. For this study, we linked two data sources for analysis. The first was the AWARD Network Data Compendium. Licensed staff requirements and staffing ratio requirements were drawn from the topic named mandates related to wages, benefits, and pass-through laws. And the minimum wage variable was drawn from the topic named staffing regulations for nursing homes and assisted living facilities. We then linked these variables with the 2020 National Post-acute and Long-term Care Study, or NPALS, restricted files. Our analytic sample included around 3,800 RCCs, representing approximately 21,000 facilities nationwide after applying survey weights. Facilities reporting no staff across all staff categories were excluded from the analytic sample. Therefore, all weighted estimates of facilities present and bed reflect this exclusion. Key predictors were the three state-level policies I just described, and our primary outcome was staffing levels measured as full-time equivalents, or FTEs, for different types of staff, and we controlled other covariates. And we conducted descriptive, bivariate, and multivariable linear regression analysis. Next, I would like to talk more about the three staffing predictors, like how the three state-level staffing regulations were measured and coded. First, licensed staff requirements were coded based on whether a state required facilities to employ or contract with licensed staff, such as RNs, LPNs, or both, as of 2020. This variable was originally derived from the RTI analysis of the Compendium of Residential Care and Assisted Living Regulations and Policy. Second, staffing ratio requirements were coded based on whether a state had minimum staffing ratio requirements in 2020. The variable was derived from the RTI analysis conducted for MACPAT. Finally, the state minimum wage variable was coded based on whether a state minimum hourly wage exceeded the federal minimum wage of $7.25 in 2020, using the data from the PHI state index. Each policy variable was coded as a binary indicator, with 1 indicating the presence of the policy and 0 indicating its absence. Here are sample characteristics. Most facilities are private for-profit, located in metropolitan areas, and chain affiliated. Facility size varied, although 1/3 had 6 or fewer beds. 45% accepted Medicaid, 21% had a dedicated memory care unit, 42% used EHRs, 28% provided skilled nursing services, and about a half provided medical appointment transportation. This table shows how the 3 state-level staffing regulations were distributed across our analytic sample. As shown here, fewer than 1/3 of RCCs were in states with licensed staff requirements or minimum wages above the federal level, whereas 2/3 of RCCs were in states with staffing ratio requirements. In terms of resident characteristics, the majority of residents were female, and nearly half of residents were 85+ years old. On average, 44% of RCC's residents were all white. More than half needed assistance with toileting, and around half of residents were diagnosed with ADRD. Regarding the staffing composition, not surprisingly, unlicensed aides made up the vast majority of workforce, accounting for about 70% of all reported staff. Among the rest, RNs represented about 12%, followed by LPNs 11% and activity staff 7%. This table shows the staffing levels by step type and selected RCC characteristics. Before diving into bivariate results, when you see the first row, the mean total staff FTE per resident was 0.83. Among the step type, the mean aide FTE per resident was 0.6, followed by RN 0.1, activity staff 0.07, and LPN 0.06. Now let's move on to the bivariate results. The significant results are yellow highlighted. As you can see here, first, there were significant differences in LPN and activity staff FTEs by ownership type, but total RN or aide FTEs are not significantly different by ownership type. The more notable finding was facility bed size. Staffing FTEs were significantly different by facility bed size for all staffing categories. In general, smaller facilities, particularly those with 16 or fewer beds, had higher staffing levels for all types of staff, except LPNs, than the larger facilities. Continuing from the previous slide, there were significant differences in staffing FTEs by resident race and ethnicity. For all staff categories, FTEs were higher in facilities with all white residents. Geographic location was associated with staffing levels as well. Rural facilities generally had higher total RN and aide staffing, although some variations remained across LPN and activity staff. Now I'll move to our main findings, the regression results. This table shows the associations between 3 staffing regulations and staffing levels, adjusting for other characteristics. First, licensed, as you can see in the first row, licensed staff requirements were not significantly associated with FTEs for any staff category. However, when you see the staffing ratio requirements, RCCs located in states with staffing ratio requirements had significantly higher FTEs for total staff aid, and activity staff. Lastly, RCCs in states with minimum wages above the federal minimum had significantly lower FTEs for total staff and aid staff. In addition to key predictors, several facility characteristics were also associated with staffing levels. Seeing the first two rows compared to non-profit facilities, for-profit and government-owned facilities generally had lower staffing levels. Looking at the next two rows, larger facilities tend to have lower staffing levels, which is consistent with the bivariate research we saw earlier. Finally, facilities that accepted Medicaid or used EHRs generally had higher RN staffing levels. Continuing with the covariates, facilities providing skilled nursing services had higher staffing levels across many staff categories, except for activity staff. A higher proportion of female residents or micropolitan location was associated with lower staffing levels among some types of staff, whereas facilities with all white residents or with higher proportion of residents who need assistance with toileting generally had higher staffing levels. Overall, our findings suggest that state staffing regulations were associated with staffing levels in different ways in RCCs, which means staffing ratio requirements were associated with higher staffing levels, where higher state minimum wages were associated with lower staffing levels. And notably, both effects were primarily observed among aides. The study has several policy implications. These findings suggest that staffing ratio requirements may be a more direct policy lever for increasing staffing, whereas minimum wage policies may need to be paired with financial support or complementary workforce strategies. Finally, future research should examine whether these staffing differences actually translate into differences in care quality and resident outcomes, and explore how wage policies interact with other workplace factors such as training opportunity and staff empowerment. As I'll wrap up, I would like to acknowledge a few limitations of this study. First, our analysis was based on the 2020 NPALS survey, which may have been influenced by the COVID-19 pandemic, a factor that we were unable to account for in our analysis. In addition, because NPALS is a self-reported survey, so the data may be subject to reporting error or non-response bias. The 2020 dataset also did not include information on other workforce-related factors, such as aided training, staff retention, or mechanisms through which wage policies may influence staffing. Finally, because this was a cross-sectional study, we can identify associations but cannot establish causal relationships. Now that more recent NPALS data are available, future longitudinal studies are needed to better understand how these policies influence staffing over time. That concludes my presentation. Thank you so much for your attention. We appreciate your feedback. We're happy to take any questions or suggestions.
All right, thank you, Jenny, and thank you, Lei. Those are wonderful presentations. I can start us off. I have a few questions. Well, for starters, and I don't know who this is really for, but just a point of clarification, if a researcher, someone in our audience today, myself or whomever, wanted to use this new resource, this new data compendium, where could they find it? Do they need to reach out to you, or is it available on your website, for instance?
Yeah, I will take this question, and Jenny, if you have any other ads, yeah, feel free to add. And I will put the link of our data compendium to to the chat.
Wonderful.
So basically, you can find everything about the data compendium there, about our policy description, the list of data set, and also the harmonized data set. So we have two types of document. One is in PDF, the other is in Excel. So if you want to use the state level ready to use data, you can just download the Excel and for your own use. So we have a couple of like suggested citations in each document, and we also have a paper published before. So if you, yeah, we would like to cite our resource, that would be great. And we are happy to take any questions or suggestions. If when you use this data set, or you may find new resources that haven't been included in our data set yet, please feel free to reach out to us. We are happy to add those data relevant to this topic to our current data compendium. Or if you find, yeah, any like questions about the variables you want to know more, but it's hard for you to find that, yeah, we're also happy to take that question. So as you may know, a lot of resource we get from the original like data resource. So we put the original link there, and we also try to put some more detailed like notes in our data compendium. So I think you can find everything from the original resource and our data compendium suggestions there. So yeah, it's very easy to use. You don't need to ask our permission to use that. You just click and download, and you will get all the information and data there.
Okay, wonderful, wonderful. And Jenny, of course, you used the compendium as part of your research. You linked it with NPALS. Um, how much time did that save you? I mean, how did y'all look up all the state regs and stuff? I'm guessing that took some work to say the least.
Yeah, so the person who actually used the data compendium, I can do a testimony.
Yeah.
So, without the data compendium, like searching and also linking the state policy data across all states would have been extremely time consuming. So, data compendium allowed us to link standardized policy variables with NPALS very efficiently and very quickly. So, I highly recommend using this data source. And for this study, we only used three policy variables. However, I think one of the biggest advantages of the data compendium was that it exposed us to many additional policy variables and data sources that I probably wouldn't have known about otherwise. So like having all of this harmonized in one data set made it much easier for researchers to identify new research ideas and efficiently link them with other large secondary data sets. So yeah, for future work, I'm already exploring some of the additional policy variables. Um, and I want to see like how they may be associated with different workforce outcomes.
Okay, wonderful, wonderful. Yeah, yeah. I mean, we've done some work on scope of practice issues here in New York and around the nation, and just looking up all those type of regulatory information via state can take quite a bit of time, obviously. And having some of that in one source, I'm sure greatly helps out. We do have a question from Kimberly in our audience. Does the data compendium include state level survey data where it is collected available from CNAs, PCAs, home health aides, etc.?
Yeah, I would answer yes, because some of our data resource like KFF, they did conduct state level surveys about the different occupations. So, and yeah, they have some like data there organized, by this survey that KFF conducted. And also it depends on the topic you are interested. Like for our training regulations, we did have some variables like based on their like occupations, whether CNAs, HHA or PCAs. But for other like type of the topics, maybe yeah, we find some limitations of certain like topic areas, like there's limited like data available there. So maybe some of the top policy topics, if you check our harmonized data set, they may organize more in a general level instead of individual like occupations. So that may be the research gap for the researchers. If you didn't find the data available there, maybe there's opportunity for you to propose some research to collect data. And yeah, if later you want to share the data with us, we are happy to put it in our data compendium. Thank you.
Oh, wonderful. I mean, why not? Yeah, expand. I would imagine as more people use the compendium, you might have more suggestions how to like make it better, add more data sets, etc. Another question, are we able to see the RCC workforce supply by state, that is the residential like care community supply by state in the data compendium?
From my memory, I didn't recall we have this data, but yeah, given Jenny, yeah, and think okay, Joanne type in the
Yeah,
chat,
no,
yeah.
that's not in the dataset.
Okay, thank you. In the
Just quick adds on what Lei said about the data compendium, because we're working on updating the data compendium. So if you have any good data sources that are not already in our data compendium, please email us or provide many good suggestions.
No, wonderful, wonderful. In in the example you provided, Jenny, the policy data was last updated in 2020, I believe. Has there been an update or are there plans to do a periodic updates? This is from Ben Stubbs.
Um, yeah, so we're working on updating all the policy variables right now. And particularly for this data, we use the 2020 data set, and all the policy variables are drawn from the same years because of the data availability issues with NPALS. Because, like, when we first initiated this research, there was no 2025 version in the field, and 2020 had so small samples, so that's why we use 2020 data set. Yeah, but as the new data set is available in the field, I think the longitudinal study with the new data set is worth considering. Yeah.
Very wonderful. And another question, well, from me, what led you to the organization of the data compendium? That is, you have multiple parts. You have like some policy description, et cetera, but then you ultimately have like kind of the more nuts and bolts. Like you have like the detailed description, prominent links, limitations. You have some examples of research articles in there. What kind of led you to that organization, and have you received any feedback on it? Like, and I'm thinking like occasionally we'll HRSA has like the federal um, companion the Compendium of Federal Data Resources. We've updated that in the past for them. It kind of has a similar flow that we have detail of the federal data source for health workforce research analysis, et cetera. And so I'm just kind of like want to dig in a little bit about how you came upon the structure for this, and have you received any feedback on it yet?
Yes, thank you for the question, David. Actually, your like data resource is one of our original research to refer to. Thank you so much. And yeah, so I can give you example like when we do the state Medicaid waiver program, we find KFF has a lot of great resource. So we reach out to them. We had a conversation with them about how they would suggest us to use their data and also their report. And we get some suggestions from them about, and also they keep updating the like research about that topic. So we try to capture the most recent published report from them. So yeah, but that's a good question. We haven't heard from their feedback on our current like the data compendium. That's a great idea. We may reach back to them to say, hey, this is our data compendium and your data is here. Like, do you have any suggestions for us to improve, or if we miss any like important like resource you want to add? And they did provide details about the survey they conducted, like and answer our questions about how we may use that data. But we haven't heard from them about the suggestion on the current data companion. And another example is about PHI. If you go to their website, they did list some state level data, but they are very kindly share the original data they organize, which is not public in their website, but they share with us of those detailed information. So we put those detailed information from PHI by state level in our data compendium. So that's the addition, like, yeah, they provide to us.
Yeah,
Okay.
one of the leadership member in this AWARD network is from the PHI, Keisha Scales. So like she provided ongoing comments and suggestions on this data compendium, and also the one of the three key predictors in my study, the minimum wage, was also originally drawn from the PHI report. So yeah, we kind of received good feedback from PHI. Yeah, just quick addition to what just Lei said.
Okay, wonderful. Right, we have another question from Gene Snyder. Your data is a great resource for researchers, but how might it be used? How might you suggest that workforce developers, practitioners use it?
Yeah, thank you for the great question. So yeah, I think the first is our policy description and yeah, I think the description there may be like helpful for you if you want to provide training for your like workforce, and you may refer to some basic information there about this policy. And also, given our harmonized data set is organized by the state, so if you want to share some map by the states to provide overview of like the minimum like training hours by certain type of workforce in which settings, so you can use maybe easily like put the data in a map and show, yeah, show in which state like the hours are higher, which states are lower. So maybe for the educational like perspective, it can, yeah, be applied by this like practitioners or workforce like organization like leaders to use this as a like, yeah, this is come to my mind. I don't know. Yeah, if Jenny, you have other suggestions.
Yeah, so I agree with what Lei just said. Just quick addition is so the data compendium is not only for researchers but for like providers and the policymakers, because like we have the documentation, like the description that provides a high level of what the policy looks like and the examples and the sources. So I think if someone are interested in see how the different states are doing, or how the different facilities are doing, they can refer to those documents. So, and particularly some of the variables Lei just mentioned, like dementia training, we just updated. That variable has very good information about across the different types of staff across the states. So like not even just for researchers, but for the general audience or providers or like more broader audiences can refer to data compendium.
Okay, wonderful. All right, once more, for those of you in the audience, if you have any questions, ask via the Q&A panel. I'd be happy to ask them for you. But one of the things I thought was interesting that you mentioned earlier, Jenny, was that the compendium itself was giving you new ideas, right? You used a few variables in it for your analysis, but there's other information in there you can also look at. And I kind of also tie this back to like providing, if I saw correctly, you're providing examples of articles under some of the data sets. And so that can also generate ideas on how to use it. Have you received any feedback on this yet? I'm just kind of curious from my own perspective
Um, oh yeah.
on that
Yeah, go ahead,
aspect of the
Jenny. Yeah,
organization.
go ahead.
Yeah.
So like feedback on the data compendium.
Yeah. And how you might make it like I like the idea that you included examples of articles in it under certain data sets, because that kind of ties into providing examples of how to use the information, much like you found found ideas of how to, when you're using it, you saw there's other data you might be able to use. Have you had any feedback on that approach? Or perhaps what I'm really trying to get at, and I'm kind of rambling here, I do that, excuse me. Uh, Perhaps what I'm really trying to get at, is there any other ways that people have suggested that might help this, like help inspire people to do other work? Um, I think I might have heard you, maybe as Lei, you mentioned that you had some Was there like some ideas for types of things that y'all had in there listed somewhere of types of research you could do? Have you got any feedback on that?
Yeah, thank you for the question. So we are actually want to hear more feedback, but yeah, given that it's a very new resource, probably it's just new to the many people like we presented in our last week Summer Institute. And yeah, many like early stage researchers are interested in this data compendium, but they may yeah have not sure where to start. So I would suggest, given it's a state level policy related data compendium, I think it may be a little bit hard to just do analysis by itself. We would suggest to link it to the data set, like you are interested, like any outcomes, like for the workforce, or even like if you have the patient's outcome, like in the state level. So there, if there's a variable by yeah, about states, and in the data set you are interested in all the data set with those outcomes, you can easily like download our dataset and link with the datasets you have. I know some of datasets may not need to go through some platform, so you may consult with them. Is that possible to we upload this data to link with your like dataset, and then you can do the research to see the policies impact on the outcomes. So this is what I would suggest if you because by our data set itself, it's all by states. So we hope to have this state link with some individual level data sets and then can see the yeah impact of the policy on outcomes.
And state certainly is a good policy level to get at. Have you considered trying to go below state at all? I mean, just that would be almost that'd be very difficult, but just
Yeah.
throwing it out there. Have you thought about it?
Yeah, we hope to get more funding if possible.
Yeah.
We can expand our work. So currently, yeah, our capacity is based, yeah, just organizing this state level data. But yeah, it's just there's a lot we can do. Like if we can dive more in depth, even in the county level or in more like yeah specific level, that would be more helpful. And yeah, that's what we can think about for the next step. Yeah, thank you.
Okay, wonderful.
Yeah, that's a great idea, David. I like that because, like, especially in California, it's really like large state and um variations. It's huge even in the same state. So I think that's something that I would um consider for the next step.
Oh, wonderful. Yeah, I'm actually interested in hearing what feedback you'll ultimately get on this tool because it strikes me as very interesting. And I could see similar data sets being developed for different areas and using this as kind of an example, obviously. With that said, as we kind of, we're about at the top of the hour, if there's one takeaway our audience should get from this event, like from both of your opinions, what is it? What should they go back to their routine afterwards and remember from this?
Yeah, I think this is a new resource, so yeah, feel free to reach out to us if you have any general ideas we want to develop based on that. We are happy to take any questions or the potential collaborations. Like, yeah, we know the research need collaborations. We hope that, yeah, if you are interested in any topic, like just give us email and we are happy to talk. So, yeah.
Wonderful.
Yeah, I'm kind of echoing what Lei just said. So the data compendium can save your time and also help you to identify a new research pathway. So yeah.
Yeah, I especially kind of like that idea of like using it to generate more research, thinking about new opportunities, etc. With that said, Lei and Jenny, thank you very much. It was a very informative webinar. I thoroughly enjoyed it. And thank you in the audience for attending. And well, I hope to see you all in the future.